Hi, I'm Dr. Brooke and I'm going to be evaluating your heart today. So the first thing I'm going to do is I'm going to evaluate the patient, looking for symmetry and looking at color. I want to make sure everything is a nice normal pink fleshy color and not a bluish color. So I'm going to be looking at the nails first, and I don't see any signs of yellowing, any signs of cyanosis where they would be blue. There isn't any swelling, and it's the same on both sides. If it were a cardiac anomaly, it would be some sort of, it would probably not be bilateral. And then I'm going to do a pinch test to ensure good perfusion. And then I'm also going to look at the face and the lips and things like that for signs of cyanosis. And then I'm going to look to the chest for signs of abnormalities. So when I'm looking at the chest, he has some hair on his chest, but that's typical with males. And then I'm going to look at his jugular vein. So I'm going to measure his jugular vein. He's not quite at 45 degrees, but I couldn't get the table to 45 degrees. He should be at 45 degrees. I'm going to put this in his external notch. And then I'm going to put this where I see the top of his jugular vein. And I'm going to measure, and it should be under 2 millimeters. And it is, it's about 1.5. So that's good. The next thing I am going to do is I am going to locate the apex of the heart, which is the apical impulse. So I'm looking for the beat, which I see probably about right here. Here. So then I'm going to feel for the point of maximum impulse. Yep. He's alive. And then I'm also going to look to the abdomen to make sure I don't see any extra heartbeats down there, which could be a sign of like an aortic aneurysm. So I looked, and now I'm going to palpate. So I'm going to begin by dragging out the tissue slack under the armpit, and I'm just going to skip to percussion, I guess. That's where it changes. That's where it changes. And then again. And that was good. So now I'm going to palpate for murmurs and for heaves. So first I'm going to palpate for heaves using the heels of my hands on the different points where we are supposed to listen to. So the atrial, pulmonary, mitral, and the tricuspid. And then I'm also going to, like I said before, feel for murmurs using fingertips, 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 fingertips. One thing we're going to say is when I was percussing the 3rd, 4th, and 5th intercostal spaces. So now I've done my palpation, my percussion, and my observation. So I'm going to move into auscultation. I'm going to be placing this on your chest and evaluating the same areas as before, but adding Erb's point. So going atrial, pulmonic, Erb's point, tricuspid, and mitral. Beginning with the diaphragm. Every time. and then switching it to the bell side. Your tummy gurgled.
Yeah.
Everything I heard was good. Normal S1 and S2 sounds. I'm going to help the patient to sit up. And we're going to do, can you swing your feet over to the side? We're going to do the aortic regurgitation test. So I'm going to use the diaphragm, and I am going to place it onto the aortic valve because it's aortic regurgitation. I'm going to have the patient lean forward and hold his breath. And nothing there. And I'm going to have you actually lay back down, I'm sorry, on your left side.
Left side.
Left side down, yep. And I'm going to evaluate the mitral valve for any sort of mitral deficiencies using the bell. And then if I had heard something, I would do the next test if I heard something out of the ordinary. So the next test is I have the patient do a Valsalva maneuver. So can you act like you're blowing up a balloon for me? And everything I heard was normal.